Good morning, and welcome to today's Oncology Data Advisor interview. Today, I'm joined by our editorial board member, Dr. Jasmin Hundal, who is a HemOnc fellow at the Cleveland Clinic. Last month, she attended the ASCO Annual Meeting, where there were a lot of exciting updates in the breast cancer space, and today she's here to tell us about two of the most exciting trials that were presented there. Jasmin, great to have you on today.
Thank you, Kara. It's a pleasure to be back, and I'm excited to share the two updates today.
Absolutely. So what was this first trial that you're planning to share with us today?
The first clinical trial is the SERENA-6 clinical trial, which is a very exciting clinical trial, which was a phase 2 double-blinded randomized clinical trial evaluating the efficacy and the safety of switching endocrine therapy, which was like from an aromatase inhibitor to camizestrant, which is a next-generation oral selective estrogen receptor degrader, which is different than the aromatase inhibitor, in combination with CDK4/6 inhibitors for patients with hormone positive HER2-negative advanced breast cancer who developed an ESR1 mutation during the first-line treatment. So the population in this clinical trial, as mentioned, was the hormone-positive HER2-negative advanced breast cancer on first-line endocrine therapy with the CDK4/6 therapy. And the intervention in this was actually using circulating tumor DNA before clinical disease progression. So what does that mean? So patients were either randomized to continue the AI and CDK4/6 inhibitor, or they were switched to camizestrant and stayed on the same CDK4/6 inhibitor using the circulating tumor DNA information. The primary endpoint was progression-free survival, and the secondary endpoints were time to second disease progression, overall survival, quality of life, and safety. So what did the results show? It actually showed that switching to camizestrant after detection of the ESR1 mutation via the ctDNA significantly improved the PFS, the progression-free survival, compared to continuing AI therapy, with a median survival of like 16 versus 9.2 months. This approach is more than half the risk of disease progression or death and delayed deterioration in quality of life in these patients. So this is actually a very exciting clinical trial because it uses the ctDNA guided therapy switching patients to assert actually before we see a clinical progression, and that definitely represents a potential shift in the clinical practice for managing endocrine resistance. So that is something definitely very exciting, and looking forward to future updates about this.
It's really amazing to hear about those impressive results.
Yeah.
Awesome. And then what was the other clinical trial?
The second clinical trial, which was also very exciting, was the VERITAC-2 trial, which was also a phase 3 randomized clinical trial, compared vepdegestrant, also known as ARV-471, which is an oral PROTAC estrogen receptor degrader, to fulvestrant patient with ER-positive HER2, like estrogen-positive HER2-negative advanced or metastatic cancer who progressed after the first prior endocrine therapy and CDK4/6 inhibitors. So the intervention was either you get randomized to vepdegestrant or fulvestrant, and then the primary endpoint was progression-free survival in both intention to treat population and the ESR1 mutation-positive patients. Secondary endpoints were overall survival, tumor response, safety, and patient-reported outcomes. The results of this one were also promising because it did demonstrate significantly improvement in the progression-free survival compared to fulvestrant in the ESR1 mutation subgroup, meeting the primary endpoint. And in the overall intention to treat population, the trial did not reach statistical significance for progression-free survival. So overall survival data is still immature, but again, it's very exciting to see this new drug on the market and seeing how we will be integrating it in the future once we see more results with it.
It's really amazing to hear about as well. These are both still in development, obviously. Are you planning to tell your patients anything about either of these results yet, or kind of wait until they're further down the line?
I think the ctDNA, we do get a lot of questions in the clinic in terms of how is circulating DNA or how is it being utilized. I think it is very exciting to we use it upon progression and like on other indications, but not in asymptomatic or like how the SERENA trial was. So it is definitely something to keep in mind and being aware of because we will get these questions in the clinic and I'm very hopeful that as more and more studies and are being conducted, and we see more results that ctDNA is more readily used in the clinic and is more readily available for our patients as well.
Absolutely. It's great to know as this data continues to become available.
Yeah, definitely. And then regarding the vepdegestrant, it's really an innovative oral medication that uses like a different technology, right? The PROTECT technology to degrade the estrogen receptor. So again, it's very interesting to see that we have other options of other treatments on the market, in addition to our, fulvestrant or other drugs that are currently being used for years.
Absolutely. Yes.
Yeah.
So as I wrap up today, you guys, do you have any like take-home messages from the breast cancer research presented at ASCO? Any like themes you'd like to underscore?
Yeah, so I think the other theme was also like how do we utilize the CDK4/6 inhibitor, how we sequence, and then also the utilization of ADC. So there were a lot of exciting advancements presented, and I'm looking forward to the San Antonio conference in December to hear more updates as well as seeing any practice-changing abstracts or presentations there.
Absolutely. We'll definitely check in then to hear about some more of the research presented too. So
Yeah, definitely.
awesome. Yeah. Thank you so much, Jasmine, for coming on. Sounds like it was a really exciting meeting. Lots of great research presented. So it's great to hear about.
Yep, thank you so much.